welcome to It's Time with Charie. I'm your host, Charie Ginete-Ilon. Recently, there was a worldwide phenomenon on curiosity about depression and suicide because two of the very popular personalities, Kate Spade and Anthony Bourdain, committed suicide allegedly due to depression. So all of us would want to know, why them? Why would they commit suicide when in fact they are very successful, they are very popular, they appear to be very happy and contented with their lives? Because they are popular people, we are very curious about them. And now we would also like to know, why depression? What is depression? And I'm very blessed today to have two of, shall I say, very reputable and what is the right term for these two people, professional, who can really talk about depression. Because of course I would not know how to talk about it. I have invited two of the beautiful ladies who are very professional and, shall I say, very knowledgeable about these matters. So please allow me to introduce to you as guests first, Miss Joanne Jomalesa, a registered psychologist and registered psychometrician of Bacolod City Mental Health Care Center. Hi, welcome to the show, Miss Joanne.
Hi, Miss Charie. Thank you for inviting me.
And thank you for saying yes.
Sure.
And I have been inviting this doctor for the past 2 years. I'm so happy she finally found time to be with me in this show today. Dr. Charibel Escandelor, a psychiatrist. She holds clinic at Villanueva Clinical Laboratories, and she's also a medicine professor at the College of Medicine of University of St. LaSalle. Hello, Dr. Bell.
Hello. Thank you for inviting me.
Yeah, and thank you very much for saying yes.
Welcome.
Okay. Diretso na ta. Dr. Bell, what is depression?
Depression is a mental disorder. So it's a kind of mental illness. It's a mood problem where the person experiences a change in activity level, a change in mood, and a change in how they think.
A change in how they think.
Yes.
In their mood. What causes this?
There are a lot of factors. So I don't think you can pinpoint just one. And usually when we talk of any mental illness, we always approach it from the biological, psychological, social, and spiritual perspective.
Okay.
So you talk biological, then you're talking about genetics, and you're talking about the neurochemicals in the brain that are actually abnormal when someone has depression. So there are certain, what we call neurotransmitters, that are very low. So when they're very low, then your brain cells don't talk to each other normally.
Okay.
And therefore, how you think and how messages are transmitted from one part of the brain to the other would change. Then there's also the genetics part of it. If there's a mood problem in the family, your mom, your dad, your grandparents have it, maybe your twin has it, a sibling has it, then you are at increased risk of also having mood disorder.
Okay.
The psychological part would be more about the person and about the personal experiences that someone has had and how they've been shaped by the nurturing that they've gotten while they're growing up.
Okay.
And how a person copes. Their defense mechanisms would determine how they'd respond to problems in life. The social part would be the environment.
Okay.
So certain things, for example, like chronic bullying in school, maybe trauma early on in life, losing a parent because the parent separated, someone went away, or a parent died, having an illness very early on, will actually predispose someone to have depression. Then in some people, there's the spiritual part. We've found, of course, that for people who have some form of faith, it doesn't matter what, as long as there's a prevailing belief system that they can hold on to when they're feeling bad, it does seem to help quite a bit.
Yes.
Not get them too deeply into depression.
Because they have someone to hold on to.
I think so.
There's
I
the
think
belief.
so.
Yeah, there's that
Belief of the higher
it's all
being.
in the mind.
And faith.
And faith.
Yeah.
Yes.
Believe
Faith.
in the higher being.
Yes. Belief in the higher being, and the spiritual aspect actually could help
Yes.
Yes.
someone
Yes.
who is suffering from depression.
Correct.
Okay, but you have stated a lot of causes, no? And so you have mentioned you cannot pinpoint actually
No.
for a particular case
No.
what causes depression, no?
Of course, when the patient comes to the clinic, they'll
Yes.
tell you their life story.
Okay.
And sometimes they themselves will say, oh, maybe it's because of this. Because doctor, I had this. And this is what triggered me to have depression, like marital problems, maybe infidelity. Sometimes a student would complain about conflicts with a girlfriend or boyfriend, or having trouble coping with school.
Yes.
And then they can identify their own triggers. But some patients do come to clinic and they just said that I've just not been feeling well. I've been feeling sad. I don't know why I feel sad. I don't know why I'm irritable.
Yeah. So some really can pinpoint the causes. Some really cannot because of chemical imbalance.
Yes. Yes.
There is really that chemical imbalance.
Yes.
Yes.
Why? What is that chemical imbalance? That's what really triggers our curiosity that we cannot explain.
Okay. Sometimes the problems are not very obvious. Say, your house being flooded and you losing everything, like ondoy kind of thing, or you're in a fire and then it's almost catastrophic that you suddenly start from nothing.
Yeah.
Okay. But I think some people are not aware that chronic stress, little problems that are there that don't get resolved with time are actually more harmful to our mental health than a big acute stress like suddenly being in a fire and losing physical possessions, material possessions.
Yes.
The chronic stress has been shown in studies to actually be damaging to the brain because your body is continually releasing a higher than normal amount of the stress hormone cortisol. Cortisol does not really encourage connections between your brain cells. And chronically, it has been shown in mice brains to actually decrease certain areas.
Yes.
So when areas of the brain are hypo-functioning, as what has been shown in advanced brain scans in other countries in people who are depressed, then I think with hypo-functioning areas, you don't really expect good thoughts and good feelings, do you?
That's why, doctor, right? Those suffering from depression, they cannot really focus well.
Yes.
Because of that reason.
Right.
Correct. Miss Joanne, we have recorded cases of depression here in Bacolod City.
Definitely. When the person goes to a clinic, a private clinic, a private psychiatrist, it is being recorded. And here in my workplace in Bacolod City Mental Health Care Center, we have several cases of depression, but not really specific depression.
Yes.
Most of them, it's comorbid or goes with another illness, mental illness.
Okay. Like?
Some would have depression and anxiety. Some would suffer from psychotic depression.
Psychotic depression?
Yes.
That's different from just depression?
Depression.
Yes. Okay.
Yeah.
Yes.
What is psychotic depression?
It already has psychotic symptoms.
Okay.
So,
Which means?
The person is already suffering depression on a chronic in a chronic thing wherein it's already long.
Okay.
And kung hindi siya na-address, it would lead to psychosis.
Okay.
And it would the person would manifest psychotic symptoms like he or she would hear voices.
Okay.
He or she would see something na hindi naman makikita ng iba.
So those are psychotic symptoms.
Yeah.
These are the times that we could say, oh, he's losing his mind.
Yes.
Like that?
Yeah.
Okay. Dr. Charibel, who can suffer depression? Anyone can suffer depression.
Anybody.
You have cases of depression in young children, adolescents, young adults, even and the elderly.
Yes.
The presentation is a little bit different. I mean, children can't exactly tell you that, "Mommy, I'm sad."
Yeah.
They sometimes cannot identify why they don't feel good.
Yes.
The adolescents, because they have better abstract thinking, their minds are a little bit more mature, then they can often identify that they're actually sad or depressed. They're exposed to social media. They read all of these things. And sometimes they say, "Oh, how come I seem to have these stuff that's listed?"
Yes.
Young adults, same thing with adolescents almost. The elderly would often not really complain of low mood, but they complain of pain here, pain there. Somatic or physical symptoms.
Yes.
But sometimes, they keep going back to the doctor. The doctor would give them medicines, but the pain seems to be very persistent. You better check for an underlying depression in those cases.
Yes.
Males and females.
Yes.
LGBTs definitely also.
Yes.
So anybody can have depression.
Yes. But now it is more prevalent. Now it is more popular. Everybody could just say, "Oh, I'm having depression." Are we using this word just for being sad, or maybe a lot of people now get depressed because of these social things happening? Miss Joanne.
Maybe because people now are more aware of
Yeah.
what depression is through the help of media, social media, most
Yes.
especially, and also through the advocacies of a lot of mental health advocates
Yes.
or mental health groups.
Yes.
So I think for me, it's good that a lot of people already have the knowledge about what depression is.
Yes.
And that's one of the advocacy actually of the Bacolod City Mental Health Care Center to spread out information about what depression or other mental
Yes.
illness is.
How can it be treated, depression?
Actually, there are several ways on how to treat depression. There's therapy. There's also medications,
Yes.
which the psychiatrist, I would leave it to the
Yes,
psychiatrist
Dr.
because
Bell.
because we are not allowed to give
treatment or-
give medications.
Yes.
It's not part of our job. But on therapy and other interventions, we can do that.
Can you mention what interventions are these?
Like for example, you would seek the help of family support, family counseling. If you notice that the family is part of the problem of the person, or you can also have different types of therapeutic interventions or approaches.
Yes.
Just like what we do in psychotherapy, we can use cognitive behavioral therapy, and what Doc Bell has mentioned, it's also very effective for us Asians, the psycho-spiritual therapy,
Yes.
because we all know that a lot of Asians are very, they believe in a higher being, no
Yes.
matter what religion, and the faith of the Asians is very strong.
Yes.
That's why evidence-based, there are a lot of studies that psychotherapy could really help Asians with regards to treatment of depression and other mental
Okay.
illness.
Dr. Charibel, how do we cure or how do we treat depression?
As Joanne said, the best combination, best outcomes would be from both medication and therapy at the same time.
Okay.
I always kind of explain it to my patients that with medications, if you're talking about a computer, the medication will fix the hardware.
Yeah.
But once the hardware is there, you need to install the proper software. And the software is actually the therapy
The
part.
therapy part.
Because if you keep thinking the same way that you thought, the patterns of thought are the same before you got depressed, then after the medicine has fixed the neurotransmitters, has fixed the circuitry in your brain, but you keep thinking the same way, you are almost always going to be vulnerable to anxiety and depression.
Yes. The problem is when someone suffers from depression or anxiety, they tend to be in a state of disbelief. They don't want to admit it. They
Yes.
are in a state of denial.
Yes.
So you cannot immediately address the problem.
Correct.
So if you are living with someone whom you think is suffering from depression, is it right for you to take action?
I think so. I think at the very least, you can make the person aware that they might need help. At least introduce the idea that they might want to see somebody.
Yeah.
The person could already, I think, try certain things to help themselves feel better. So some of my patients will sometimes, go to the gym to exercise. They go to Bible meetings regularly. They'd also try to be with friends and talk about how they feel.
Yes.
But as one of my patients said, well, I tried all of those things and I didn't snap out of it as I thought I would.
Yes.
So he said that I thought it was better to see somebody
Yeah.
because it might be beyond what he could do to help himself. And he was right.
Yes.
He was right.
It's still best to see a professional.
Yeah.
I think so because when the mood symptoms are already affecting how you relate to other people,
Yes.
how you do your job,
Yes.
and I suppose the sense of wellness is
Yes.
just overall lower than what you're used to.
Yes.
I think people would often tell me that they don't feel like they're themselves.
Yeah.
And it's unpleasant not to feel like you're yourself.
Yes.
So I think that's what makes them seek help
Yes.
from someone like me.
Okay. Ms. Joanne, from your experience in Bacolod Mental Health Care Center, what are the cases that usually trigger someone to be in this state? No, if you have interviewed, if you have seen someone to be in therapy at Bacol Mental Health Care Center.
Initially, the triggering factor for those suffering depression is sudden life experiences that are very unpleasant.
Okay.
Like there would be people, or there's a person who would go and seek help from us and would tell us that a significant person had just died.
Yeah.
And then there's also some that are victims of bullying, very common with the adolescents. And also there are those that are really parang chronic na yung experiences,
Yes.
that they cannot already pinpoint what really triggered for them to feel down,
Yes.
and they cannot really focus anymore. And then with those cases that appears to be chronic, we
Yes.
would really go down to their
Yes.
history and
Yes.
really check what's really the cause
Yes.
of their depression.
And then you keep this record confidential.
Yes.
And then they
It's
could
a
go back
standard
to
operating
the
procedure.
healthcare center anytime they like and
Yeah.
seek help.
Usually, when we do counseling or therapy, it's a series of sessions.
Yes.
So it's not just one sitting thing,
Yes.
and then everything will be okay.
Correct.
So usually on a first session, we get to establish rapport.
Yes.
I get to know what really is the chief complaint of the patient. Then afterwards, upon studying the case, we would set a schedule again, and then I would give several interventions and approaches on what's appropriate for that person.
Yes. Dr. Charibel, you have mentioned a while ago that sometimes it's the coping ability also of that person. Meaning to say, if that person is not strong enough to cope with the problem, he or she could suffer from depression.
I don't think it's a matter of being strong enough.
Okay.
But I think certain people use certain behaviors repeatedly since they were little.
Okay.
And they're used to that. They don't change because it's worked for them. Then you transfer them to a new place, a new situation. Then suddenly the old behavior does not work anymore.
Yeah.
That's not coping.
Yes.
Because you need to adapt to the new environment.
Correct.
You often see this, for example, now in children who need to go senior high.
Yeah.
Because senior high was not available
Yes.
before. And then there are only certain schools that offer the senior high program. So sometimes you come from, some area, not from Bacolod City, and then because you want to do college, you need to go senior high, so you need to transfer here.
Yes.
Then from a 30-person class and like 120-person batch,
Yes.
you go from that to 1,600.
Yes.
Where you feel like
Cannot adapt.
where you
You're
feel
a
like a
social-
non-entity,
Yeah.
where maybe you don't have any of your classmates in your section, and then everybody seems to know everybody else, and the other people already have their own groups and barcadas. How do
Yes.
you even try and fit in?
Yeah.
So you didn't have to do that in your old school because you'd known them since you were in elementary,
Correct.
right? So no need to
There's the
actually
familiarity.
have develop social skills to do
Yes.
that. And you know how kids nowadays are always on the phones.
Yeah.
This actually does not encourage socialization. So
It's called social media, but actually
it's
it's
lack
less
of
of
socialization.
Lack of socialization.
Lack of social contact with people.
Yeah.
And when you don't really play
Yeah.
out in the yard with other children, there's less practice at conflict resolution. There's less practice at handling disappointments when you don't win in games.
Yes.
There's less practice at frustration tolerance when you don't get what you want. Less
Correct.
practice at disappointment. So,
Thus, they're more prone to.
yes.
Yeah.
Because
Depression.
they don't have this in
Yeah.
their armamentarium, their tools of what
Correct.
to do
yeah, they are not being
Yes.
prepared for the real
for the real world, so to
real
speak.
world. Yeah.
Yes. So it is still important to expose our children.
Oh, yes.
To human interaction.
Human interaction.
Yeah.
Social
Definitely.
interaction. is
Definitely.
very important. No?
Because we are social animals.
Yes,
Diba? No man is an
definitely.
island,
Yes.
sabi.
That is why when someone is depressed, that person would like to hide in
Yeah.
the room.
And
would
some
not
of the
take a bath,
Yeah.
would sleep for the rest of the day,
Correct.
etc. No? But this is just the things that I've heard about people suffering from depression. What are usually the behaviors of a person suffering from depression?
Okay. The psychiatrists here in the Philippines would follow the Diagnostics and Statistical Manual of Mental Disorders. We are in the 5th edition. And this is actually formulated by the psychiatrists in the US.
Okay.
Because there's another criterion, the International Classification of Diseases. the 10th ed that the rest of the world follows.
Okay.
But I don't know.
Ironic.
We've been colonized by the US before. I don't know. We just follow
Okay.
the American system. But anyway,
Okay.
that DSM-5 has a criterion, and it lists down the sorts of behaviors that you might see in a person with depression. So the most important thing, of course, is that you need to have low mood or irritability for more days than not.
Okay.
So in children,
Most
it's
of the things
often
that
irritability.
Okay.
In the older ones, then they'd often be able to identify low mood.
Okay.
Then if it's not that, then it's the second one where the person loses the motivation and loses the ability to enjoy the usual things that they enjoy.
Yeah.
So, wala gana mag-eskwela, wala gana mag-go to work,
Yeah.
daw hindi motivated na to reach targets, for example, at
Yeah.
work, etc. Things like that. Then there's changes in sleep and appetite.
Yeah.
So they could be sleeping too much, hypersomnia, or having difficulty sleeping, waking up in the middle of the night, or waking up too early. But the unifying factor there is that the sleep is not refreshing. So they don't feel rested when they
Yeah.
get up in the
When they
morning.
wake, yeah.
Okay.
The appetite, they could be overeating, like
Yes.
binging,
Yeah.
or they could have no,
No
appetite at
appetite at
all,
all.
so they would lose weight.
Yes.
And the losing weight part, it's 5% over a month without dieting of the body weight you started out with.
Yes.
5 to 10%.
Ooh,
Okay. Then you also have other people noticing that you kind of move differently. There's psychomotor agitation where you look restless.
Okay.
You know, or psychomotor retardation where you look like you're slowed down.
Okay.
The people in Ilonggo would sometimes comment that you're kauyaya sa imo.
Okay.
Or ka-slow mo, pero may maggiho. A lot of patients would often complain that they open their eyes, they wake up, and then they already feel tired. So the fatigue is something that stays with them.
All
So
the
it's not
time.
like they're doing anything very physical.
Yes.
Work-wise. It's even if they're just sitting on a desk, they would
Yes.
often feel
Feel
tired.
tired.
Yeah.
And that's what inhibits patients from getting out of bed, taking a shower.
Yeah.
Because sometimes my patients tell me, Doc, I just imagine myself going into the bathroom and turning on the water. I already feel so tired. So that's why it's a challenge. When the
Yes.
depression is very bad, the energy level also goes down. And the fatigue just is all throughout the different aspects of their lives. Then you have problems with concentration, focus, memory.
Yes.
So they also often say, ga lipat-lipat.
Lipat-lipat.
Even
Uh-huh.
the recent ones.
Difficulty making decisions. There are people who sometimes have difficulty choosing what to eat.
Okay.
And it's so confusing what to eat. That's how bad the impairment in decision making
Yes.
is.
Yes.
Then, emotion-wise,
Yes.
they have feelings of hopelessness, worthlessness, or they're experiencing extreme inappropriate guilt.
Oh.
And last but not the least, the one that is most unpleasant, of course, is suicidal ideation or attempts.
Yes.
You have 5 of those,
Yes.
9 for 2 weeks, for more days than not. That's already a major depressive disorder.
Major depressive disorder.
Yes.
And the worst thing that could happen is that they would take their own life.
Yeah,
That's
suicide.
correct.
But I think, why is it that in some cases, like what we've heard about Kate Spade and Anthony Bourdain, it was a shock to everyone that they took their life because they appeared to be normal. They appeared to be not
That's the keyword.
exhibiting
Yeah, that's the
these
keyword. They appear
behaviors.
to be.
Yes, they appear
Yeah.
to be. No? So that's the last thing that a person having depression can do.
Yeah.
I think when they don't see any way out,
Yeah.
I think when they feel like they've been boxed in and they're
Yes.
suffering so, and they don't see any way
Yes.
of making themselves feel better, and the
Yes.
despair is very bad,
Yes.
then they think about that.
But this can be helped.
Yes.
In cases here in Bacolod, in your experience, how can you help? You have mentioned already, no, some of the cases, some of the things that you have done. But how can we help? And if we have noticed a person, a loved one, perhaps a friend, who is suffering from the behaviors that have been mentioned by Dr. Charibel, how can we help?
Actually, us in the Bacolod City Mental Health Care Center, we are very available
Yeah.
with invitations like this to give information about several mental illnesses
Yes.
or mental health disorders. And we are very available to talk to schools,
Yes.
to barangays, and to certain groups so that we will be able to speak about what mental health is.
Yes.
So actually, it's not just talking about depression.
Yeah.
It's really about talking about how to take care of our mental health.
Yes.
And usually with those activities, we were able to enlighten our audiences regarding what mental health is. And
Yes.
as what WHO and DOH, the World Health Organization and the Department of Health
Yes.
slogan would be, that they would say that there's no health without mental health.
Yes.
That's why it's very important. And then we are very happy that Mental Health Act is already there to really help out with regards to mental health issues in our country, because the stigma is still very high.
Yes.
But now that it's already in the open, what really depression is, and with the help of media, of course, people are already gaining knowledge
Yes.
about how to prevent depression, or if you feel something, or if you feel the symptoms, you try to reach out.
Yes.
It's not a silent. It's not going to heal you if you are being silent.
Okay.
Yeah, because as what Doc Bell had said, people would sometimes just lose focus. And if they don't really have focus, and if they don't have support from other people, they would
Yes.
think otherwise. And
Yes.
that's why some people would just end
Yes.
their life, because they think that's the best way in order to end the pain.
Okay. But how can we help? We, people living with our loved ones who perhaps are suffering from depression. Can we help them?
family
How can we help, Doctor?
I don't think that it requires anything fantastic
Yeah.
to help
But just-
someone with depression. I think the first thing that people should do, and family members often forget, is to just listen
Yeah. Listen.
and be available.
Very important.
I don't
Yes.
think that you are expected as a family member to say anything fantastic.
Correct. Just be there.
Yes,
Just be
because
there.
if you are not a mental health professional, then we don't really expect that from you.
Yes.
But what your family needs from you, or the family member in pain needs, is the support. So maybe encouraging them to go to their doctor's appointments,
Yes.
helping them remember that they need to take their medication.
Yes.
Sometimes it's not unusual, of course, in Filipino families to always have one other family member during consults.
Yeah.
So the other family member also listens, and then sometimes they'd say, "Oh, Doctora said that you should do this and
Okay.
that.
So
Did you do that
remind
already?"
gently, no?
Reminders
Yes.
like that. And then I think we teach them not to be overcritical,
Yeah.
not to. Sometimes they think that tough love always works, but it doesn't. That sometimes the patients feel like the family doesn't understand, because the family would say, "Positive lang bala, hindi lang na bala pagpanumduma." Ain't that easy?
Yes.
There's something going on in the brain. So you
Yes.
can't just be happy. You can't just make yourself happy when your
Yes.
brain is sad.
Correct. Sometimes you have to take a medicine already for
Yes,
that.
yes,
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 yes.
yes, definitely.
Yes.
Because
And-
you need to fix the circuitry first.
Correct. Oh wow, my circuits.
The hardware.
The hardware.
Yes,
Fix the,
the
hardware.
hardware,
But
yes.
it's also good to fix the software, and that's
Yeah.
where we can
Add-ons.
help.
Yes.
The add-ons, the support system
Yes.
is still
Very
very
important.
Very
Very
important.
important.
Very important.
Yes.
I think in countries where suicide rates are higher, what you would find is that the family is probably not as extended. You don't get as much help from family members as you would do here.
Yes.
Here kasi sometimes you'd have multi-generational households.
Correct.
You'd have the lola and the
Yes.
titas and the grandchildren,
Yes.
etc. In first world countries, they'd often be living by themselves,
Yeah.
maybe with a partner,
Correct.
and then the family members are spread all out the different areas of their countries.
Yes.
And they're pretty much alone. So it's a little bit harder, I think, for people to detect that there's something wrong.
Yeah, that
Unless-
is why.
Yes, unless they're very self-aware,
Yes.
then they would seek help themselves.
No,
But
that doesn't
otherwise,
happen.
no one's gonna push them to go
Yeah.
see a doctor or a psychologist.
Correct. True.
Again, human interaction is very
Yeah,
important.
human
Yeah.
interaction.
That's
That's sad to say
certain
because of
touch.
these gadgets and social media.
Yeah.
Human interaction is
Yeah.
quite not as often anymore, no?
Yes,
Especially
yes,
for
correct.
people who really need it. And when we return, we will talk about how to take care of our mental health, because you mentioned,
Yes.
Ms. Joanne, that it's important to take care of our mental health, perhaps to avoid. Can we avoid it?
Yes.
To avoid depression. If it's chemical imbalance, it might be difficult. Diba? Anyway,
But
we'll
there's
talk
a
about that
solution.
more when we return here on It's Time with Charie. Please stay with us. New, fully furnished. 3 bedrooms. Spacious receiving room, dining area, and kitchen. Your classy hotel in a strategic location, accessible with easy access to private and public utility vehicles. Ideal for visiting groups and families, with superior service and comforts of a hotel, yet uninhibited stay like a home. Jung's Realty Hometel. Dr. Charibel Escandelor and Miss Joanne Jomalesa of Bacolod Mental Health Care Center. Dr. Charibel, how can we take care of our mental health?
Oh, I think that a healthy lifestyle is a prerequisite. When you eat good food, when you avoid drugs, when you avoid too much alcohol consumption, you're already partly ensuring also the health of your brain, aside from the health of your body. These substances, of course, especially those that are addictive and non-addictive ones like nicotine and alcohol, actually do have receptors on the brain, and they do affect how the brain is functioning.
Oh.
So we are not encouraging
Yes.
that you indulge in those things.
Yes.
A balanced diet is also important because you cannot separate your body from your head.
Yes.
So when you eat a healthy diet and your plate is very colorful, you have a lot of antioxidants there, you're actually also preventing inflammation
Yes.
and having so many pro-oxidants that can affect your brain.
Yes.
There are new theories actually about the connection between the gut and the brain.
Yes.
And papers, you can read them online, would actually have evidence that how healthy your gut and flora is,
Yes.
gut bacteria is, can sometimes predispose you or protect you from having depression. So, healthy diet,
Yes.
healthy lifestyle, definitely. Part of the healthy lifestyle is exercise.
Yes.
When you exercise, you increase blood flow. You
Yeah.
increase blood flow, you increase oxygenation to the brain.
Yes.
Increase oxygenation, good for brain cells.
Yes.
So,
That's
you start
what-
there.
Yeah.
You start with a good lifestyle first.
good and healthy lifestyle.
First.
Okay.
Then, of course, there's stress management. You need to know how to handle and how to react to problems that come your way.
Yes.
I always say that the problem is often not with the problem per se, but how you react to it that will make you sick. Say you have 100 households that got burned by fire.
Yeah.
When you examine the people mentally
Yes.
afterwards, you'd often find only maybe of 100, maybe 3, 5 that would manifest symptoms of depression.
Yes.
How come the other 99 were okay?
Yeah.
Because
Because
I
they
think
can
the other 99 would focus on things like, oh, at least everybody's alive,
Yes.
everything else can be worked for,
Yeah.
we can start all over again just as long as everybody's safe.
Yes.
So they focus on the good,
Correct.
even when the event was bad.
Yes.
But the 5 maybe would focus on, oh, we have to start from scratch again. We worked so hard to get all of those stuff up, and then now there's nothing. We weren't able to save anything. They focus on what they don't have.
Yes.
And that's why part of depression is what we teach is sometimes having patients do a gratitude journal.
Yeah, yeah, yeah.
So
Be
things
thankful.
to be
Yeah,
things to be
yes.
thankful for every day.
Yes.
Because when you list down the things that you can be thankful for,
Yeah.
it teaches your brain to focus on the good, on the positive.
Yeah, positive. Yeah.
So it's training.
Ah.
It's training your brain to focus on that.
Yes.
Because the brain is not wired for positivity, really.
Ah, yeah.
The brain is wired to look for danger, to look for things that are threatening to us,
Yes.
so that we can protect ourselves and go on.
Yes.
But the world is not as dangerous as it was in the caveman period.
Yes, correct.
You have groceries now, you don't need to hunt for food.
Yes.
But
Everything
our-
is easy.
But our bodies react as though we were still in the caveman era. When we become anxious, when we become desperate about certain
Yes.
things, the same biochemical reactions happen. But the threat is not the same. Well, the threat's different.
Yes.
The perceived threat is different nowadays.
Yes. I love that.
Yeah.
Good lifestyle.
Mhm.
Stress
Stress
management.
Stress
Now,
management.
One of the things that could really help
Yeah.
you is to become thankful.
Yes.
Yes.
Think
the
of
gratitude
the good
list.
things,
Yes.
the positive,
Yes.
and the things that you have,
Mhm.
not the things that you don't have.
Correct.
Okay.
And I would
Miss
just
Joanne,
also like to
yes.
emphasize that you should also know your boundaries.
Yes.
Because a lot of my patients would, I would notice that they have a lot of tasks.
Yeah.
They don't know anymore what to do.
Yes.
And sometimes it causes their depression because
Yes.
sometimes a task won't be completed and everything. So sometimes it's really important also to know your boundaries.
Don't spread yourself too thin.
Yes.
Yes. It
And
could cause you too
and
much
also learn
stress
to
as
say
well.
no.
Oh, learn to
Yeah,
say
know
no.
your capacity, you know your boundaries,
Yes.
kung asadiin ka lang.
Oh. What are the
This is very
campaigns of Bacolod City Mental Health Care about mental health? No? You mentioned that you are campaigning to take care of mental health. What are the campaigns that you recently now
Actually,
have?
yeah, we have a full blast advocacy campaign, especially during October,
Yes.
where we celebrate the Mental Health Month, and also on special days like the Suicide Prevention Month, that's on
Yes.
September, and the day would be September 10.
Yes.
So we would also have advocacy activities for that. Sometimes the DOH would give us specific area where we
Yes.
would talk on suicide during September, and then we would also have anti-drug abuse campaign between October to December
Yes.
for the anti-illegal drugs,
Yes.
also in connection with the anti-illegal drugs campaign of our
Yes.
president.
Because drug addiction and alcohol consumption could trigger.
Yes,
No,
yes,
you
yes.
have
As what
mentioned, no?
Doc Bell has
Diba?
mentioned.
No?
Yeah.
So I'm curious also, because we have a lot of men and women walking down the streets of Bacolod City who have lost
Yeah.
their minds.
The vagrant.
No, the vagrants, not just
Psychotics,
the,
yeah.
the psychotics. Do we have a program for these people?
Yes, actually, the one handling the vagrant psychotics would be the anti-mendicancy team under the city mayor's office. So if they would, actually, we don't have enough financial assistance for that,
Yes.
but the government is really trying hard
Yes.
to really focus on these people.
Yes.
And then if they would find somebody roaming around and causing, displaying violent
Yes.
behaviors, they would report it to the anti-mendicancy,
Yes.
and then the anti-mendicancy would refer it to us for consultation. And then the anti-mendicancy would take charge on finding their relatives. And most of them are not from Bacolod City.
Okay.
That's the reality.
Yes.
Most of them are not from Bacolod City.
Okay.
And it's true what you've heard, that some of the families would bring them here to Bacolod City because they know that we have a
Oh.
government psychiatrist,
Yeah.
and we have a government center for them.
And we have a most livable
Yeah.
city.
Yeah.
But Dr. Charibel, depression can also push you to this psychotic behavior that you forget about your family, you forget about everything important. Could that push you
it's
to
not
do that?
very
No.
often.
Not often.
No, it's not very often.
Okay.
Majority of the cases that we see are depression
Yes.
or maybe depression with mania, meaning bipolar disorder.
Okay.
Because those are both mood
Yes.
disorders. Schizophrenia and delusional disorders, brief psychotic disorders fall under the umbrella of psychotic disorders,
Okay.
where patients lose contact with reality.
Yes. Oh,
Okay.
that's different.
Yes, that's
psychotic
usually
disorder.
different.
Yes.
You can have depression with psychotic features, meaning to say you could have depression but you're hearing voices. But the quality of the auditory hallucinations is different than the ones you'd see with psychotic patients.
Yes.
And if you treat the depression, sometimes the hallucinations would also resolve.
Yes.
But there'd be cases, of course, when you need to give 2 medications for those things. So it depends on the presentation of the patients.
Yes. Depression can really be cured.
Yes.
Yes.
Yes. Yes.
And it could be cured as fast as 6 weeks and long as 6 years. Depends on the situation.
Okay, when you give medications, you would usually need to wait about 2 weeks before you feel the effects of the medication. That what we call therapeutic trial. The time you give the medications to work
Yeah.
would be 6 to 8 weeks.
Okay.
So 1.5 to 2 months. If you are responding to the treatment, then by the end of 2 months, you should almost be symptom-free.
Okay.
Okay. Then after the 2 months, you add on the number of months on the medications depending on how long it took you to seek consult with a doctor.
Okay.
So, if you were sick for just a month
Yes.
before consulting, then you just add on about 3 to 4 months of treatment, complete the 6-month regimen, then slowly taper the meds, then you're gonna be medication-free. But if you've been sick for maybe 3 years before you came to the doctor,
Yeah.
then after you reach remission of symptoms, you should continue on the medication for 3 years.
Oh.
So you
that
stay,
it will not
you stay
go
on the
back.
medication for however long it took you before you
Before-
went into remission.
Yeah. But how you wouldn't know when you suffered depression?
Oh, the history taking
Yeah.
will tell the doctor
I see.
and give the doctor an estimate.
Okay. You are able to do that.
Yes, yes, yes.
That's why. No?
But
very
the
important.
decision of staying on medication is always discussed with the patient.
Yes.
You explain to them the need, then it's their choice whether they want to stay on it or risk having a relapse if they want to go off it.
Yes. Okay.
They relapse, we still need to help them.
It's
Don't think they have
They
a
go
choice.
back to you again.
Bottom line, it's still the decision of that person.
Yes,
Yeah,
of
yeah.
course.
Suffering
We would
from
like
depression.
to encourage what we
Yeah.
call autonomy.
Yes.
in our patients. We don't want to be dictating to them
Yes.
what they do and not do. We present treatment options, then they choose the ones that they think are suitable for them or the ones that they would want to try.
Yes. Okay.
Because if you get their cooperation, I think they're more likely to stay on your regimen than if they thought you were kind of forcing them
Yes.
Correct.
towards a certain path.
Correct. Okay. So we have a lot of things I would want us to discuss, but we're running out of time. Miss Joanne, for you, representing the Bacolod Mental Health Care Center, what would you like to tell our televiewers how to deal with depression? What is the best thing that we ought to do? We should not, I think, no, we should not think, okay, just think positive, kimadula lang,
Yes.
amuna permi, no? It does not have, it does not go away, no?
Yes,
No.
yes.
Okay, correct. So now we know that. What should we do?
So if you feel the symptoms, if you have the symptoms, as what Doc Bell had mentioned, the several symptoms, if you feel down, if you don't have focus anymore, if you think that the recent unpleasant life experiences has affected you a lot, seek help.
Yes.
I mean, there are a lot. If you're a student, you have a guidance counselor to go to.
Yes.
If you're a Bacolod City resident, you can always come to our psychiatrist, private psychiatrist like Doc Bell,
Yes.
or to us, to Bacolod City Mental Health Care Center, to
Yes.
seek help if you really feel those symptoms, because it will not go up. It will not go. It will
Not
stay
go
there.
away.
Yeah,
It
it
will
will
not
not
go
go
away.
away. It will stay there if you won't give attention to it.
Yes.
And remember that there's always help.
Yes.
That there's always a chance for you to live again normally, and that medications are there, therapies are there, and then a certain lifestyle change would help
Yes.
your condition. So it's really more of knowing your feelings,
Yes.
accepting what you're feeling, and don't deny it,
Yes.
so that you will be able to get help.
Yes. Seek help.
Yeah, seek
Okay.
help.
Thank you very much, Ms.
Welcome.
Joanne Jomalesa. Dr. Charibel, what should we do? Ms. Joanne has already mentioned a lot of things, but from your psychiatrist's point of view, especially that we know that there's always a stigma, she's going and seeing a psychiatrist. Though, dumdum nila buang lang ka pa psychiatrist. No, di ba? No. So, your advice to our televiewers.
I think I would like to emphasize that depression is a mood disorder. It's an illness. Okay? And it's an illness, but it's not equal to crazy.
Yes.
Okay? And it's not equal to buang.
Correct.
Depression is not being maarte. Depression is not being attention seeking. Something is going on in the brain. The structure of the brain is affected. So how the person thinks and feels and what the person does actually changes when there is depression. So if you would treat other illnesses affecting another part of the body, why wouldn't you seek treatment for the brain, which is probably the most important organ
True.
in humans?
Yes. So seek help and make sure that your brain gets treated.
Oh, yes.
It is an illness. Depression
Yes, true.
is an illness. And we have to treat it. And
Yes.
with the people whom we know who are perhaps suffering from depression, we should not judge them. We should listen to them and offer our support to them.
Correct.
Diba? Don't be judgmental, guys.
Correct.
Diba?
Correct.
Okay. So thank you very much, Dr. Charibel Escandelor.
Welcome.
I hope we will have a part 2, 3, 4, 5, 6. No, because yes, we get to learn a lot from you. And of course, there are so many diseases, mental health issues that we
Yes.
need to talk about.
Okay.
Diba? I hope we'll see you again here next time with Charie. Thank you very much, my dear friend Zara.
Special mention.
Yes, okay. So thank you, Miss Joanne Jomalesa.
you, Miss
And once
Charie.
again, thank you, Dr. Charibel
welcome.
Escandelor.
Yeah.
The best. No, I love it. Now we know about depression. Need I say more? It is not being buang. It is not being maarte. It is an illness that we need to treat. Thank you very much for watching. It's Time with Charie. I'm your host, Charie Ginete-Ilon. Please don't go. I still have one gap with you here on Sky Cable TV 32. Once again, thank you, Dr. Charibel Escandelor and Ms. Joanne Jomalesa. Please stay with me. fully furnished. 3 bedrooms. Spacious receiving room, dining area, and kitchen. Your classy hotel in a strategic location, accessible with easy access to private and public utility vehicles. Ideal for visiting groups and families, with superior service and comforts of a hotel, yet uninhibited stay like a home. Jung's Realty Hometel. Hi, welcome to It's Time with Charie. Now I'm going to share with you some tips on how to change your mind. They say it's best to probably change the way you think if you would want to change the way you live positively. So allow me to share these tips with you. Number 1, give yourself the time to think. Most people keep themselves much busy. They continue activity with, or they say, they refuse activity with accomplishment. But if you're just busy and you're not accomplishing some things, then that is different. If you want to perform well, you need time to think. So time to think well. You can't do that if you never set aside time for just thinking. So, number 1, give yourself time to think. Number 2, find a place to be creative. I believe that a person who possesses mental discipline can think anywhere. However, there are also people who would think better if they have a place where they could really think. So give yourself a place to be creative. Number 3, force yourself to think. If thinking were easy, everyone would be good at it, but it is not. So sometimes you just force yourself to think. That's why you need to make it a discipline, make it a habit. Give yourself a goal to think for a certain period of time. Number 4, see problems as opportunities. Yes, problems are actually opportunities for you to do better the next time. People who achieve their dreams don't take no for an answer. They are undeterred by obstacles, and they see problems as opportunities. That, in a nutshell, is the essence of entrepreneurship, seeing opportunities in problems. So learn to think that way, that you have unlimited resources for success. And perhaps they could also be a lot of solutions to a problem, not just one solution to a problem. One problem could have many solutions. Number 5, challenge assumptions. One of the most insurmountable obstacles to successful thinking is that the phrase, but we've always been doing this. Hey, stop and try to think differently, and perhaps challenge the way they have been doing that for several years to perhaps become more successful. Number 6, explore every option. Unsuccessful people think that there is just one right answer to a problem, but it is not true. There are many options. Number 7, recruit other thinkers to help you. If you're in a company, ask other thinkers or hire other thinkers to help you out to make sure that you succeed. Well, there goes the 7 tips on how to change your mind. Thank you so much for watching. It's Time with Charie. I'm your host, Charie Ginete-Ilon. Give me a call at 476-9353 or 0932-538-7591 if you would want to know more on how to change your mind. Thank you so much. Please always watch It's Time with Charie on Sky Cable TV 32. You can catch me every weekend at 7 o'clock to 8 o'clock every Friday and Saturday, and 8 o'clock to 9 o'clock every Sunday only on Sky Cable TV 32, and every day on my channel 34. Thank you so much. God bless us all.